articles. We traveled around the country to talk to people who are doing interventions on the ground. There are several things that became clear relatively quickly in our research phase. One is that we really needed to focus on the intake side of the equation. Physical activity is incredibly important for health overall, but because of the scale and scope of the problem and because of the degree to which the food environment has changed in the United States, it was going to be impossible to actually have an impact on the problem without focusing primarily on food and the intake side of the energy equation. And not only that, but because of the rate at which prevalence has been rising and the fact that it's been rising among all populations, we also recognize that it would be necessary to take an environmental approach as opposed to focusing on individual behavior. So that led us to really focus on the food environment. Another thing that we quickly realized was that if we were going to have an impact on childhood obesity, we really had to go after the population at large, and that's because many of the determinants of childhood obesity actually occur before the child's even born. So by the time a child expresses obesity, it's often too late to have some of the most effective interventions. There's already potential predisposition. And the third thing, which became relatively clear, was that you really had to go after prevention as opposed to treatment. Prevention is much, much more cost-effective. And again, for a number of kind of physiological reasons, once obesity is expressed, the body's metabolism changes and it becomes very difficult to treat, which is why diets often don't work. So those were the three kind of clear outcomes from the initial research phase that really led us to focus on the overall food environment. So the simple fact is that food consumption has been increasing over the past couple of decades. So this is showing total per capita calorie availability over the course of the 20th century. This is basically how the USDA measures overall food consumption at a nationwide level, because actual consumption